In this video, we're going to review how to navigate the Sage Electronic Medical Record System using a view-only case. Let's jump into a case study and explore the electronic medical record. Click on the green magnifying glass to get started. When you open a view-only chart, the first thing you will see is a brief blurb about the patient case. This blurb is meant to orient you as to what is happening with the patient at the time of the case study. This patient, Long Vien, is a 7-year-old who has come to the clinic for asthma management. He was seen in the emergency department 2 weeks ago for an asthma exacerbation, according to the blurb, so we should remember that and make sure we review his emergency visit. Click Continue to enter the chart. On the top bar, you will see a picture of the patient and vital information about them: name, date of birth, medical record number, and any information restrictions for the patient are listed here. Information restrictions will list people the patient has instructed their care team to not discuss any information with. The allergy list is in the next box. In the third box, we see a list of the patient's current providers. This patient is an outpatient, so the only current provider listed is primary care. Patients who are hospitalized may have many more providers listed here. On the left side of the screen, we see the navigation bar, and we are currently viewing the patient's dashboard. The patient dashboard is customized to each institution and user type. The dashboard shown on screen is the clinic provider dashboard, which includes the patient's demographic information, active diagnoses, current medications, reason for visit, history, immunizations, and allergies. If you are a nursing student, your dashboard may include different items such as due and overdue medications, most recent vital signs, and a list of nursing orders. Going back to the navigation bar, if we click on Prior Encounters, we can find the notes written from the patient's previous visits within the system. We can see this patient has an emergency department visit from 2 weeks ago. Let's click on it to open it. In this view, we can read the patient's note and see what happened during his emergency department visit. We can click the title again to close the note. Likewise, we can click any other note's title to open the note and read through it. The Scanned Documents tab includes any documents that might need to be scanned into the system, like consent forms or release forms to disclose health information. For example, if a patient needs a blood transfusion, you would want to check the Scanned Documents section to see if there is a signed transfusion consent form on file. The Procedure tab is similar to the Encounter Notes tab in concept, but is specific to procedures performed. If you needed to review documentation from a past surgical procedure, this is where you could find the procedure note. This patient has never had a procedure done, so his is empty. The Medications tab is for medications that are to be administered during this encounter. This patient does not have any medications ordered currently. We will review medication administration in a later video. The Notes tab refers to notes written during the current encounter. This patient has a note that has been partially written but is not yet signed by the pediatrician. We can tell the note is not complete because the title says pended. Let's open it and take a look. This note is a standard SOAP note with the patient's history and physical exam findings, but the assessment and plan is empty. This area of the chart is particularly helpful for assignments because incomplete notes often give us history and assessment information. Under Diagnostics, there are 3 categories: laboratory, imaging, and cardiac. Laboratory refers to specimens that are sent to the laboratory, such as blood, urine, or sputum. Laboratory findings are organized chronologically in the EMR. Imaging refers primarily to radiology findings. X-rays, CT scans, MRIs, and ultrasound findings will be documented in note form here. Just like in previous sections with notes, you can open the note by clicking on the title. Cardiac is where electrocardiograms, or EKGs, can be found. Click on the EKG title to open the image. For the student edition of the EMR, EKG interpretations have been omitted to encourage students to learn to read their EKGs. Under flowsheets, there are 4 major components: vital signs, nursing assessment, patient safety, and IO devices wound care. Vital signs includes all documented vital signs in chronological order. You can document vital signs here as well. Let's try it by typing 98.8 into the temperature row and clicking Sign. Vital signs include temperatures, heart rate, blood pressure, weight, and cardiac rhythm interpretation. Moving to the Nursing Assessments tab, here you can find documentation of physical assessment findings categorized by body system. Click the category to open the body system. Some categories have drop-down menus like level of consciousness. Other categories support numeric or free text entry like pupil size. Let's document a level of consciousness and the right pupil size, and then sign them to commit them to documentation. The Patient Safety tab is where nursing staff would document their hourly patient rounding, change of shift handoff reporting, and restraints. Just like in nursing assessment, some boxes are drop-down menus, where others support free text. This time we will document that the change of shift report was given, and that we have given a handoff to Nurse J. Click Sign to commit them to documentation. Next, IO Devices Wound Care. Here we can document intake and output, devices like ostomies and urinary catheters, vascular access, and wounds. Let's document a peripheral IV that we just placed in this patient. Select the correct date and time of placement in the first 2 boxes. Then select the location, laterality, and site assessment findings in the next 4 drop-down boxes. Commit these to documentation by clicking Sign at the top of the screen. Now let's say we wanted to change the dressing on this IV. Select the location and laterality, and then we will enter a dressing change date and time. Then we will commit by clicking Sign. Finally, the Orders tab allows you to place orders for the patient. He doesn't have any active orders right now, so let's order an albuterol inhaler dose for this patient to be given in the clinic right now. Type albuterol into the order search and choose the albuterol option, then press Enter. Select MDI inhaled for route, once for dose frequency, and scheduled for schedule. We want to give this patient the 90 microgram per puff dose to start today and now for just 1 dose. Adding an end date is helpful for medications that need to stop on a specific date. For example, if you had a patient who needs an antibiotic every 8 hours for 5 days, you could either limit the number of doses to 15 by entering 15 for the number of doses, or you could enter an end date and end time that you want the recurring medication schedule to stop. Instructions are for medications that require specific instructions. Let's add a medication that requires one to try it. We will order a PRN 25 mg dose of atenolol to this patient's chart, just like we did last time, and add instructions to hold for a heart rate of less than 60. Now let's click Sign Orders to commit the orders. Now the orders we just placed are in the Active Orders side of the Orders screen. The active side of the screen will display all active orders. Some case studies will have a list of currently active orders already populated in this area. Just like a real patient's chart, some of those orders may be your responsibility as a student, so make sure you review the orders placed on each patient. We hope this guide was helpful. Thank you for watching, and thank you for using Sage.